Hello, my name is Ava Fisher, and today I wanted to talk to you about what I believe is a very pressing issue in both psychology and just the general public that everyone must be educated on. Abnormal psychology is the study of psychology that deals with psychological disorders, which are syndromes that have a significant effect on an individual's emotions and behavior. These are maladaptive behaviors that are destructive to one's everyday life. This behavior is destructive because it typically affects every aspect of life and is often addressed through a comprehensive regime of both medicine and therapy. There are various approaches to psychological disorders. One approach is known as the medical model, which is the concept that psychological disorders have physical causes that must be addressed through a hospital, typically through medicine. For example, an individual afflicted with depression may take SSRIs or selective serotonin reuptake inhibitors, which is effective because depression is usually associated with a low amount of serotonin, and this addresses this by preventing the reuptake or the reabsorption of serotonin back into the brain. So this just increases the overall level of serotonin, which is good for people with depression. Another approach to psychological disorders would be the biopsychosocial model, which is the model of behavior that addresses biological factors, social factors, and psychological factors. This is the most common used model today, as most psychologists believe a singular model to be limiting, and this is more comprehensive to truly provide people the treatment that they need with psychological disorders. One may also identify disorders using the DSM-V, which is a diagnostic guide that describes the psychological disorders and their prevalence. One may use this guide to determine the type of psychological disorder and the specific psychological disorder one may exhibit symptoms of. There are a few variations of disorders, including mood disorders, anxiety disorders, and schizoid disorders. So some anxiety disorders would be generalized anxiety disorder, which is very common in Americans particularly, and is marked basically like what it sounds, by general anxiety in uncomfortable situations, which is coupled by an increased heart rate and awareness due to increased epinephrine or the fight or flight response due to hormones. Or maybe it may be a social anxiety, which is triggered by uncomfortable social situations. These individuals are typically more introverted, and their anxiety is triggered by situations that they believe to be harmful to themselves because they can't handle that social interaction. Another anxiety disorder would be obsessive compulsive disorder, or OCD. So in obsessive compulsive disorder, one may have an obsession and they deal with it using a compulsion. So an obsession is a persistent and irrational belief that some event is going to happen, and a compulsion is what the individual afflicted with OCD believes can help with this. So for example, if one has OCD and they have this obsession that their family will be killed, they deal with it with this compulsion of maybe having a ritual of turning the lights on 5 times every time that they enter a room because they believe that this would solve this. And it doesn't necessarily matter that people recognize that these beliefs are irrational because they are persistent and will not go away without a treatment of medication and therapy. This kind of thinking may be harmful and maladaptive to their life because it's not seen as socially acceptable. It's kind of taboo typically. Another kind of disorder would be mood disorders, which include depression, major depressive disorder, which basically just are marked by often suicidal thoughts or just a decreased satisfaction in life and this kind of emptiness that also must be addressed through medicine or treatment. Another mood disorder would be bipolar disorder, which is marked by way highs and way lows, affected by the chemical imbalances of the brain. If there are happy chemicals being produced, they are at a high, and if it's the sad chemicals, they are at a low. Yet this could happen, this kind of shift between high and low may happen over a number of days or a number of hours, just depending on the situation. Another psychological disorder is post-traumatic stress disorder, or PTSD, which is caused by a traumatic event that affects one's entire life due to reoccurring nightmares or visions of this event that affect their life greatly. If they are triggered by this event, a trigger could be anything relating to their event. They could have panic episodes, or what they're called panic attacks, episodes where they just cannot be reached by other people, and it's this increased heart rate and anxiety that kind of consumes their whole life. There are also other psychological disorders that don't fall under these categories, such as eating disorders like anorexia nervosa, which is one's distorted body image of themselves. They may believe that they are much more overweight than they actually are, and to cope with this, they starve themselves because they want to achieve this image of fitness and of thinness that is often contributed to by society, because we turn this notion of having to be the thinnest as the image of fitness. This just contributes to that further. And what I believe we can do for our part is to educate ourselves on the causes and symptoms of psychological disorders, because they are more common than one would believe, and they ought not to be scorned. They ought to be receiving treatment for these, because if we see these disorders as taboo, there's less funding and support for mental health institutions and greater awareness. And I encourage you to do your part to solve this by educating yourself and educating others. Thank you for coming to my TED Talk.